it's fixing the backlog from COVID. Also just allowing people to access the care that they need as and when they need it. Just going back to when I'd say my childhood times, when you could just go to the doctors and get an appointment the same day. Just going back to basics really. But I also 100% understand that COVID has completely changed the landscape, and also lifestyles have changed the landscape. People have more mental health issues than they've ever had before, and I know there's other pressures, and I know it's not as easy as going back, but I think just fixing the basics, that will help loads.
A few months ago, and to be fair, I was seen very, very quickly by the massive amount of pain I was in, and they did actually help me very quickly, which I was very thankful for. Obviously a big part is just retaining the staff that they have. Obviously making sure that everyone that works within the NHS is getting paid a fair amount for the work they do.
When Graham's mum was ill and in a home, we dealt with social workers, we dealt with other agencies, and we did find communication was very, very poor. The care, I will never criticise the care that she was given, but sometimes we would give information to one agency and it was never passed on to another.
They could focus on improving, vetting the staff a lot better so they understand the patient's needs and values really.
So I struggle quite a lot with my GP, so unless you phone at like 8:30 in the morning, you don't get an appointment for that day, so then 9 times out of 10 I end up in urgent care for the sake of antibiotics, and I'm waiting 5-6 hours when I know I shouldn't be there. There's more people that are worse than me, and all I need is antibiotics.
And alright, as I said before, there is a waiting time, naturally. I mean to say, there isn't only me that's poorly or got what I've got. There's other people worse off than myself.
Well, I've had quite a few problems with the doctors and everything like that. They know I've got a problem with my toe. They keep saying, come back one day, come back the next day. I went back, and at the moment it's bleeding. I've got to put a bit of tape round it.
I think that NHS needs more nurses to support people in the community.
Well, I think it's all the delays in the system at the minute, but obviously we are all coming out of the COVID pandemic, so I do understand it, but when it's regarding you just want the appointment, you want to get sorted.
I went to my GP who referred me to the hospital, and I've heard nothing at all. So I've not been able to walk now for 6 months or more, depending on people to take me and fetch me, and been in dreadful pain. So in the end I went to Glaston.
I'm okay with my GP. I'm okay to get an appointment with my GP, but sometimes I'm struggling to get an appointment with the dentist.
To be focused on, I think recruitment drives need to be a bit more out there, and the accessibility to them.
We do need a long-term plan for the elderly. The reality is this country is getting old. There's going to be more and more demands on what the requirements are for elderly people, and there's more and more treatments available. There's more, but somewhere we need to have some joined up thinking. That's instead of you doing a bit there and you doing a bit there and you doing a bit.
Obviously the work that you two are doing out here today actually is a big part. Just being able to speak to people within the community just helps massively to gauge what's going on within each specific community. So I don't know, something like maybe a text message service or an online chat service could be really useful, especially for people with perhaps social anxiety.
I think more online services, because obviously as a parent of 2 young children you've got a lot of questions and there's not a lot of support.
Along the lines of support, I feel prevention's better than cure. So if you can do more within the communities for mental health or drinking disorders or even antisocial and drug disorders, because then if you prevented it, in the long run you won't have the burden on the NHS coming for, say, an alcoholic coming for liver transplants and everything, because they won't have got that far where they've deterred themselves that much.
I'd like to see more help in befriending and helping people who are isolated in their homes.
So I think, you know, the NHS perhaps traditionally has been very focused on treatment as opposed to prevention, and I think the NHS could do more around prevention and holistic wellness, and how things like social connections and tackling loneliness and having healthy relationships can be kind of a catalyst to good mental health and good well-being.
I think, to be honest with you, in this particular space, I think the NHS are trying really hard to empower people to take ownership of themselves and set good habits. And you see a lot of adverts on the TV about mental health, and I think it's about empowering people, giving the power back to the people, flooding them with as much information as possible about where to go. But then when they do get there, being able to access that support as well.
So in regards to like steps that can be taken, so obviously in educational environments and colleges, I know they do like pop-up events rarely, just based on things like CPR and things like that. But what could actually be really good, obviously they already do a lot, which is amazing. But just going into schools in general.
I'm not sure how much you can do to empower people when it seems to me that preventative measures are already in place. Things like smear tests are available to a certain age category, but I know people who don't take advantage of it, and I personally don't understand why. If you make them available, you call for an appointment and you choose not to take advantage, I'm not sure what anybody else can do. And I think we are so lucky in this country, probably more than we actually realise, that these things are available.